In this sketch, we'll take a road trip to learn all about vitamin E. And away we go! This family is heading out to Posterior Columns National Park Road. We'll be accompanying them going and coming. So sit back, relax, and let's begin. Vitamin E is a fat-soluble vitamin that exists in 8 different forms as tocopherols or tocotrienols. Our body preferentially uses alpha-tocopherol, the most biologically active form of vitamin E. What's the big deal about vitamin E anyway? Well, first, it protects cell membranes from oxidative damage by neutralizing free radicals. Yeah, that's right. It's an antioxidant, a scavenger for free radicals, a savior of cell membranes, an unsung hero. And like this girl trying to protect her precious bubblegum from her brother, vitamin E protects polyunsaturated fatty acids from peroxidation. Vitamin E may also prevent the oxidation of low-density lipoproteins, or LDLs. Recall that the main job of LDLs is to transport endogenous cholesterol from the liver to peripheral tissues. There's been some research suggesting that oxidation of LDLs may be a contributing factor to the development of atherosclerosis. However, clinical studies have shown no benefit with vitamin E supplementation in preventing cardiovascular disease. So yeah, it's kind of like using Rust Guard on your canoe. Looks cool, but probably not worth investing in. Besides acting as an antioxidant, vitamin E may also play a role in inhibiting cell proliferation and inducing apoptosis. At least that's what we thought until RCT showed no benefit with vitamin E supplementation in treating certain cancers. Vitamin E may also reduce platelets from sticking to each other. But again, whether or not there's any clinical benefit is yet to be fully addressed. What we do know is that vitamin E may provide some neuroprotection in people with Alzheimer's disease. Data from RCTs have suggested that vitamin E might slow functional decline in Alzheimer's patients, even if it's just not as fun as playing Sudoku with your grandma. Just to clarify, vitamin E doesn't prevent or reduce the chances for developing Alzheimer's disease, and should not be given in that regard because of the potential adverse effects, which we'll talk about later in this sketch. Looks like our family is headed back home. Talk about a trip. Check out the before and after pictures. Do you see that E ornament on the hood of the car? Yeah, neither do I, because Mom hit a deer 20 miles back. It's okay, guys. The deer is alive and well, and I never liked that ornament anyway. I guess this is a good starting place to talk about vitamin E deficiency. But before we go over the clinical manifestations, let's first address why someone would be deficient. You're probably thinking that inadequate dietary intake is the main reason why most people are deficient in vitamin E, but that's not quite the case. Vitamin E is found in a variety of foods, like nuts, seeds, vegetable oils, egg yolks, fortified cereals, and green leafy vegetables. So it's pretty rare to become deficient just from not getting enough in the diet. Vitamin E deficiency occurs more frequently in people who can't digest or absorb fat. This is a recurring theme for all the fat-soluble vitamins. Pancreatic insufficiency due to chronic pancreatitis or cystic fibrosis, cholestatic liver disease, celiac disease, inflammatory bowel disease, or prior bariatric surgery are some reasons to have fat malabsorption. Rarely, the genetic disorders A-beta lipoproteinemia and AVED cause vitamin E deficiency. A-beta lipoproteinemia is an autosomal recessive disease caused by a mutation in the microsomal transfer protein, or MTP, resulting in deficiencies of ApoB48 and ApoB100, which are necessary for lipid transport, especially of very low-density lipoproteins, or VLDL. Here at Sketchy, VLDL is represented by a very low-density hot air balloon, in this case dropping the B anchor to reflect the deficiency of ApoB. AVED, short for ataxia with vitamin E deficiency, is a genetic disorder caused by mutations in the alpha-tocopherol transport protein, which allows the liver to package vitamin E into lipoproteins so they can be delivered to peripheral tissues. Now that we've talked about why you might be deficient, we can talk about what happens if you're deficient. This little girl's popped red bubblegum will help you remember that vitamin E deficiency causes hemolytic anemia. As we mentioned earlier, vitamin E protects cell membranes from oxidation. When there isn't sufficient vitamin E available, free radicals accumulate inside RBCs, damaging cell membranes and causing RBCs to pop or hemolyze. Peripheral blood smear will show the presence of acanthocytes, also called spur cells. They represent spiculated RBCs with irregular thorny projections that kind of look like many pointed stars. I bet this kid's feet are sore after wearing cowboy boots all day on the hike. Should have listened to Mom, Junior. Besides RBCs, long axon neurons are also prone to oxidative damage because they contain cell membranes with large surface areas. Vitamin E deficiency is usually associated with neuromuscular dysfunction, and muscle weakness is a common complaint. It can even make your arm so weak that you can't bother your sister anymore. Other symptoms include unsteadiness, clumsiness, loss of coordination, or ataxia, in the hands or feet, slurred or slowed speech, or dysarthria, and difficulty swallowing, dysphagia, because vitamin E deficiency affects the spinocerebellar tracts. Vitamin E deficiency causes loss of position and vibratory sense due to degeneration of the posterior columns, shown by the degenerating columnar rocks in the background. On an exam, look for physical exam findings of reduced proprioception and loss of diminished deep tendon reflexes. The neurological manifestations of vitamin E deficiency often mimic that of Friedreich's ataxia or vitamin B12 deficiency. How do we differentiate them? Look for a family history of neurological disease to suggest Friedreich's ataxia, and vitamin B12 deficiency will also present with megaloblastic anemia, hypersegmented neutrophils, and elevated methylmalonic acid levels. Another finding in patients with vitamin E deficiency is infertility. Why? Because low vitamin E results in the degeneration of germinal epithelium and Leydig cells in males due to oxidative damage. To remember male infertility, just picture this wizened testicle tree. Yep, just one of many weird things you'll see here at Posterior Columns National Park. Oh, and by the way, see that jacked up front fender of the car? We made the inner workings look like phospholipids because vitamin E deficiency reduces serum phospholipids. Let's turn our attention to talk about what happens if you take too much vitamin E. First, the good. Taking high doses of vitamin E may be beneficial in patients with non-alcoholic fatty liver disease or age-related macular degeneration. The liver-shaped roadside ad for a local diner will help you remember fatty liver disease, and Mom's foggy glasses for macular degeneration. Dang, Mom. Is that why you hit that deer earlier? Okay, now the bad. Taking high doses of vitamin E interferes with vitamin K metabolism and increases bleeding in anyone taking warfarin. There's also a higher incidence of hemorrhagic stroke in adults who take high doses of vitamin E. We drew a red lure on Mom's hat so you can remember the association between vitamin E and hemorrhagic stroke in adults. And finally, the ugly. High doses of vitamin E have been associated with a higher incidence of necrotizing enterocolitis in infants. Taking over 400 units per day may even increase all-cause mortality, so please only give vitamin E when your patients absolutely need it. Okay, I think we've had enough of this road trip because I kinda need to use the restroom. But I can probably hold it. First, some tour highlights. Vitamin E is a fat-soluble vitamin and antioxidant that protects cell membranes from oxidation. Vitamin E also prevents oxidation of LDLs and may slow functional decline in patients with Alzheimer's disease. Vitamin E deficiency is caused by inadequate dietary intake, fat malabsorption, and rarely A-beta lipoproteinemia or AVED. The clinical presentation is muscle weakness, neurological dysfunction, infertility, and hemolytic anemia. While high doses of vitamin E may be helpful in patients with NAFLD and age-related macular degeneration, there's a higher incidence of hemorrhagic stroke in adults and necrotizing enterocolitis in infants.